Greetings and welcome to In Depth. I'm Dike Rostant, Deputy Chief Secretary of the Tobago House of Assembly and the Secretary for Health, Wellness and Social Protection, Dr. Faith Brebnor. She recently met with Health Minister Dr. Lakram Bodo. Now she joins us now as we find out what that means for deepening health-focused collaboration between Trinidad and Tobago and more in this episode. Thank you very much for joining us, Dr. Brebnor. No, you met with the ministers, and I heard as ministers. So,
yes.
Which minister? Because we know Dr. Lakram Bodo. So, fill us in a little bit now.
So I met on that day. Was a very busy day. I met first with the minister with responsibility for social welfare, which is Vandana Mohit. And then I met with the minister with responsibility for health. It was a really good set of conversations where we discussed how we could work better with each other. So very fruitful conversations.
And it's interesting because we'd spoken previously on that combination, but I think just the fact that you met with both of those ministers, take me through it again, please, in terms of looking at the fact at how health ties into social and social protection.
Right, so the division that I lead is health, wellness, and social protection. The health part, of course, is pretty self-explanatory. We are the ones who have policy direction over the Tobago Regional Health Authority, the health centers, hospitals on the island. The wellness part actually treats with the public health institutions, so the health inspectors, the garbage collection, that kind of thing. And then we have the social protection component, which is the social network. So in essence, I'm glad you've highlighted it in Tobago because we have limited number of divisions. I am actually responsible for what would be 3 in essence ministries in Trinidad. So we still have a few others to work with.
Once again, glad you're able to make that time. But in terms of those meetings, you said yes, they were busy, and I believe you said they were fruitful. But what were some of those things that you would have covered?
Certainly. So, we have to figure out. So let me probably step back. The Tobago House of Assembly is a creature that is a result of, the Tobago House of Assembly is a creature that is a result of the Tobago House of Assembly Act. That act says that in Tobago, we are responsible for doing several key things. We are responsible for implementing whatever the national policy is at the local level on the island. So anything that treats with health, even though there is a Minister of Health, the Minister of Health does not have direct responsibility. It comes through me, the Secretary, goes to the TRHE, and then we function. The same applies for the social network. It comes through me as Secretary, goes through the department, and then we function, we execute. So what we were able to do is really identify ways to ensure that whatever the national agenda is, it works for the Tobago specific population, and that we don't have duplication of services, for example, we don't have wasting of resources, and that all Tobagonians are able to benefit from the services that are available in Trinidad and Tobago.
Do you find that the conversations that you would have had speak to partnership? And I say that because sometimes it can feel as though the resources are here, or the person who has the resources can sometimes communicate in a manner that is a little stronger than a suggestion. But at the same time, where those resources are going, would have a better idea how they're supposed to be used. Hence the need for that sort of partnership. What was the feeling coming out of the conversations?
So I have to admit that I left those meetings with a renewed sense of purpose. I left those meetings under having both sets of ministers truly understanding how we work in Tobago and how we are able to use the word partnership in the most meaningful way. To the point where we now have to work through the nitty-gritty of the how. We've recognized, for example, that there are grants within the Ministry of the People and Social Development that we have never actually really experienced in Tobago. And we now have to work through how to use, for example, our social workers that are part of the Tobago House of Assembly to help us to go through the application process and so forth, to ensure that the average Tobagonian does not have to leave Tobago to go to Trinidad, or to ensure that the ministry does not have to hire a second set of social workers to do the work when we have social workers already on the ground doing that kind of intervention on the island. So we really started working through how do we get the resources to the people in the most effective, efficient way without duplicating, without wasting resources. And that to me was the most interesting part of those conversations. And as I said, I left with a renewed sense of purpose coming out of those meetings.
I want to ask you about the reason for the need for that sense of purpose to be renewed, because you spoke of trying to avoid duplication of services, trying to avoid wastage. Give me a little context in terms of what the situation would have been preceding those conversations and this transition that we're facing now.
So, I always try not to get TTT in trouble. But
honestly,
honestly, before now, this was actually the first time I'd actually had a real in-depth meeting, for example, with the minister with responsibility for social development. And I have been in this position since 2021, December 2021. So it really is an opportunity. It really was an opportunity for us to look through what the national policies are, recognize that these are the national policies. We are not necessarily trying to change the national policies, but there are ways that they can be implemented in Tobago that may be very different to how they are implemented in Port of Spain versus Cedros. And it is that kind of us drilling down into me truly understanding the people who elected me, the people who I am here to represent. I am the one who gets the call from the old age pensioner who says, I come in the office and this is what happened and they treat me bad and that kind of thing. So I now have that kind of information that I could share with them to say, well, yes, the policy says this, but maybe we could implement it in a way that is a little different.
I think sometimes it's not just the what, but the how. Because, exactly. So like I learned from my daddy, I'm very happy to say no thank you. And so it's not as though people, because if you say thank you to everybody, then you need to have a certain sort of relationship, as opposed to, nah boy, if you deal with that person this way, and they're vexed, they're raising their voice or anything, but at the same time, there's a level of communication between. But just before we take the break though, I want to ask, from where you sit as secretary, what are the areas of focus or the main areas of focus? And I'm not sure if I should ask for the three distinct areas in terms of health, wellness, and social protection. Thanks.
So let's start with social protection, since that's what we've been focusing on. I think our main area has been to figure out how we are able to provide that social network that allows our clients to graduate out of needing the social support that they've come for. So you've come for rental assistance, you've come for housing assistance, you've come for food assistance. What can we do with you to ensure that in a year from now, you don't have to come back to us, or in a year from now, you can say, it was wonderful, thank you so much, but bye, I don't need your services anymore. So we've actually been building within the division a method of doing more behavioral change figuring out what exactly is the challenge, because we recognize a lot of people aren't able to do financial management, for example. So we are trying to build in that kind of support for clients. We are expanding on the therapeutic counseling. So, you're just not functioning because you are burdened with all of these other issues in your head, working through that, working through with the mediation that may be necessary for you and a family member to work out what really needs to happen for the safety of the home and so forth. Those are the kinds of things we are switching to and we are improving on. We also provide a seed grant for small businesses. So you come in because you need a food card and you said, well, I have a little business, but I really just need some help with buying, the blender and the fridge. Yeah, we're actually helping you with that, because we know if we provide that kind of support for you, you may not need the food card a year from now.
And I appreciate that. And before we go to the other two areas, I think we'll take the break here. But one of the things I appreciate about it, because, sometimes as opposed to setting people up, having a foundation or base from which they can go and flourish, sometimes I feel as though you're minding someone in that situation. And that longer duration of engagement, it takes more out of both parties, because one, according to some people, you don't get a chance to raise your nose because you're kind of approaching people cap in hand. And two, that also allows you to focus on someone else. Exactly. Especially when you are the person who gets those calls, especially when you use the person when somebody see you buying whatever in the market, they brace you and tell you, but but we take the break now and we return. We're speaking with Deputy Chief Secretary of the Tobago House of Assembly, Secretary for Health, Wellness and Social Protection, Dr. Faith Brebnor. We return after this. Stay with us. Welcome back. We are here for part two of this conversation with Dr. Faith Brebnor, and we started off looking at priorities for that area of social protection. Health and wellness. Take me through them one by one, thank you.
Certainly. So health is the bulk of what costs at the Division of Health, Wellness and Social Protection. As I said, a lot of people don't recognize that I have, as a Secretary for Health, I need to approve upwards of $40 million every single month for us to keep the hospitals open, the health centers functioning and so forth. So we've actually been now trying to figure out what do we need to do in the gamut of health services to reduce the need for health care. And that means doing primary prevention. It means doing secondary prevention. What does that mean? We're actually trying to beef up what we do in the health centers so that we could prevent patients from having to migrate into the hospitals, because the care in the hospital is significantly more expensive than the care that you receive in the health center. What does that also mean? We have very high levels of non-communicable diseases, the lifestyle diseases, the heart disease, the high blood pressure, the diabetes, and so forth. And those, fortunately or unfortunately, are diseases that we can also control with lifestyle changes. So we are really working with our healthcare providers within the primary care setting to figure out how we can re-inject more of that, so that, again, when somebody comes in with pre-diabetes, we work with them holistically to ensure that they don't migrate over to actual diabetes. Because when you get to diabetes, it means you now have to deal with kidney failure. It means you now have to deal with loss of eyesight. It means you're now probably getting an amputation. It means you're getting all of these things. And if we can simply prevent you from going down that path, then you do not have to enter into the secondary care system, which is costly. So we're really trying to work through at the TRHA right now how we can make that shift holistically, so that we may not see the change immediately, but I'm hoping that when we look back 3 years, 5 years, 10 years from now, we can say this shift in how we do primary care is what caused the shift in the landscape of our health services a couple of years from now.
How much of that shift includes addressing the mentality of individuals? And I say that because sometimes it feels as though I get something on my finger to go hospital, as opposed to being able to go to the primary care centers.
Yeah, and that has to do a lot with how we communicate what is available at the primary care facilities versus what is available at the hospital. And the reality is, if we do not have a health center that is open at 9 p.m., they will go to the hospital. So that is also part of what we are working through to ensure that there are urgent care, for example, facilities that are available later in the evening. So you don't have to go up to A&E because you can go to this extended service health center to get that kind of care. But that comes with a bit of mental shift. It comes with us communicating. It comes with us putting those systems in place first, communicating them, ensuring that when people try them, they actually work. Because the only thing you need is for somebody to show up at 9 o'clock and somebody tell you we close for the whole thing to break down. So it is really ensuring that we have all of those systems in place so that when people are ready to do the shift, it is as seamless as possible.
A little earlier in the conversation, we spoke about looking at what services are there, looking at the resources that are needed, making sure that you try to make things as efficient as possible. This makes me want to ask the question, Granny or Tanty, they have a intuitive remedy, a herbal response to something. Like I have a granny, she used to grate Vixen in nutmeg and that make it even stronger. But is there a position on how it is the healthcare system in terms of TRHA would be dealing or engaging with intuitive traditional healers?
So I think we all have grannies like that. I had one who used to go outside and pick whatever bush she picked, blend it up, we drink it, and whatever the ailment was, we all got better. It was the worst tasting thing ever, but it worked. And because we know we've come from a culture of that, what we try to communicate with the clients is, we are not telling you to not do that because that is a losing battle. But what we are encouraging you to do is understand two critical things. One, the bush tea actually works. So the fever grass actually works because there's a chemical in the fever grass that is interacting with your body that's causing the fever to go down. So don't think that because it is natural, it means that there is no chemical inside it. It is a chemical inside it that's causing it to work. And because we understand now there is a chemical inside it that's causing it to work, we need you to let us know when you are taking these things so that we ensure that the chemical that's in the fever grass not interacting with the chemical that's in the tablets that the doctor given you. And we are really trying to encourage people to have that kind of conversation so that it is working together so that the doctor can understand, this patient not taking that blood pressure tablet, they're not taking it. So what else can we do? Where else can we have the conversation? What else can we do on the side of nutrition, for example? We know that they will eat garlic morning, noon, and night before taking that blood pressure tablet. And knowing that we understand that, what can we do now to ensure that everything works together? So I think it's having that kind of shift in mentality. We're not saying no, because that is a losing battle, but let's figure out how we work together. And we're encouraging patients to talk to your doctor, let them know this is what you're doing so that they can take that into consideration when doing a prescription for you, for example.
And I think that also raises the point of building capacity in terms of academia, seeing what it is we have here and how it is we can take it forward, as opposed to somebody find it out eventually and then bring us the next best thing that we have been using on one or the other level all the time. But before we go though, because we have about a minute and a half, but let's say 2 minutes, one meeting is fine, one meeting and you come away feeling good. What are the next steps?
So we already have other meetings set up. We already have other site visits that are tentative. I would not want to announce them outside of the ministers making those specific announcements as well. But it's a continuation. We continue to collaborate even after those meetings. We've had several conversations back and forth. So it truly is a collaboration where we feel finally that Trinidad and Tobago are actually walking side by side. And I think that is something that a lot of people don't really understand. You know, when Tobago speaks about getting greater autonomy, when Tobago speaks about having this relationship with Trinidad be strengthened, it is not because we want to separate and remove the country known as Trinidad and Tobago. It is because we understand what is happening on the ground here. We understand what we need to do on the ground here to improve ourselves. And we just want to be given the opportunity to do that so that we truly can be an equal partner in this relationship known as Trinidad and Tobago that we all love.
Thank you very much, Dr. Brebnor. Beautiful point to pull the curtains down on the conversation. Secretary of Health, Wellness and Social Protection. And this has been In Depth with me, Dike Rostant. On behalf of the entire team, thank you so much for tuning in.